Hello, my name's Hannah. I'm one of the nurses here at the Evewell. Today I'll be showing you how to give the Zivafert injection. Sometimes it is called Gonasi, just depending on the dosage that you've been prescribed, but they are the same medication and are drawn up and prepared the exact same way. Okay, so to start off with, you'll have a clean, flat working surface and clean and dry hands. In the box, you will have a pre-filled syringe with the water in to mix with the solvent. So it will also come in a vial with powder as well. And 2 needles. One is a drawing up needle, the longer green one. And then the smaller one will be for doing the actual injection. So to start with, what you'll do is take the cap off the pre-filled syringe with the liquid in it. And then you will be popping it on to attach the green drawing up needle to the liquid. That air bubble that's in there, that's completely fine. You don't need to worry about getting rid of that before injecting it into the vial of powder. So you get your vial of powder and then just break the top off the vial so that the rubber stopper is exposed. Once that's exposed, take the cap off the syringe and then inject it into the top of that. And then you want to inject the entire volume of liquid into the vial of powder. The air bubble's fine to go in there as well. That instantly dissolves, and then what you want to do is pop it on an angle like that with the syringe all the way submerged into the liquid, and then just draw the entire amount of solution up until it is all back in the syringe. You may notice some air bubbles in there. That's completely fine. I will show you how to get rid of those ones shortly. If you are prescribed a dose that requires a 10,000 unit dose and you were given 2 vials of 5,000 unit powder, what you can do is then do exactly what I've just shown you. Take that one out and then inject the liquid that's in the syringe into the second vial of powder and inject all of that solution back into it. Let that powder and liquid dissolve into another liquid and then draw the entire volume back up, and then you have your complete dose in one syringe. Just like that on an angle. So you can mix 1 syringe of water with 2 vials of powder and it won't affect the medication. Just saves you an injection. And what you do is just gently remove that from the stopper. You can give it a little flick to get the air bubbles out like that. So once all those air bubbles are at the surface, just gently press up on the plunger until the air bubbles are mostly out. Tiny little ones are okay. Sometimes it can be very difficult to get rid of all of the air bubbles. But if all of the big ones are gone like that, then we can change the needle ready to inject. You'll pop that in the sharps container and you'll pop on the needle for injection to the end of the syringe there. Once that needle's attached, what you'll do is just take off the cap of the injectable needle until that needle is exposed. What you do then is find the area of subcutaneous tissue underneath your belly button, so in your lower tummy, and pinch that one up. So it is a subcutaneous injection, and then just inject at a 90-degree angle into your tummy and press down on the plunger until all of the liquid is administered. Gently remove, and then you'll just discard it into the sharps container once you're finished.